Hi, my name is Kelly Shoemaker, and I'm doing a health assessment for NU302 for health assessment for nurses on the neurological system. Hi, my name is Kelly, and I'll be performing a neurological assessment on you today. I'm going to perform different tests on your cranial nerves, memory, everything that is involved in a neurological test, like motor function, senses, and reflexes. So first you're going to observe the patient and just look at their overall presentation, see if they have overall general hygiene. Have you had any problems with your memory today?
No.
Have you experienced any trauma or head or neck injury?
No.
Have you had any problems with your ability to carry out any of your daily tasks?
No.
Do you have any chronic diseases?
No.
Any that run in your family?
No.
Do you have any neurological illnesses?
No.
Have you had any changes in your vision, your hearing, your sense of taste, smell?
No.
How about your balance? Is it normal?
Yes.
Any numbness or tingling in any of your extremities?
No.
Are you having any pain today?
No.
Do you get headaches?
Yes.
Can you describe them for me?
They're in the back of my head.
Okay, and on a 0 to 10 scale, what would you rate your pain as being?
5.
And what makes them worse and what makes them better?
Makes them better when I lay down and worse when I'm at work if I have one.
What brings about a headache?
Daily activity?
Okay, and have you ever used any illicit drugs or have any past alcohol use?
No.
Do you smoke?
No.
Do you have any problems eating or drinking certain products?
No.
Are you currently taking any medications?
No.
Have you ever been exposed to any chemical hazards
No.
or environmental hazards?
Nope.
Okay. So I'm just going to start off by asking you some general questions. Can you tell me your date of birth?
June 14th, 1989.
And what year is it currently?
2013.
Okay. Who's the president?
Barack Obama.
And where are you currently?
At home.
Okay, I'm just going to ask you some basic math questions, okay?
Okay.
What's 4 plus 2?
6.
And what's 10 minus 5?
5.
What's 10 times 4 plus 3?
43.
Okay. And now I'm just going to test your abstract ability of thinking. Can you tell me your interpretation of don't put all of your eggs in one basket?
That you shouldn't have all of your options. You should have other options besides one.
Have you had any changes in your mood lately?
No.
What do you do for a living? What's your occupation?
I'm a medical assistant at a doctor's office.
Okay, and do you plan on continuing education?
No,
And can you tell me why?
because I don't want to.
Okay. Now I'm going to assess your cranial nerves. I'm going to test your sense of smell first. Do you need to blow your nose at all?
No.
Do you have any allergies or a cold?
Yes.
Okay. This is testing olfactory nerve 1, and if a patient states that they have a cold or something, your test may be off, just depending on which nares is closed. Okay, go ahead and close your eyes and close one side of your nose. Smell this?
Coffee.
Okay. And this?
Cinnamon.
And this.
Vinegar.
Okay, and I'm going to have to ask you to close your eyes again and hold the other side of your nose. I'm going to smell this.
Coffee.
Okay. Next.
Cinnamon.
Okay, and one more here.
Vinegar.
Okay. Good job. Now, if the patient's not able to smell, there may be some nerve damage, or they could possibly have a cold, as the patient stated, or maybe a zinc deficiency. Now I'm going to test your vision. This is optic nerve. This is the optic nerve, which is cranial nerve 2. I'm going to hand you a newspaper here. I want you to tell me where the newspaper is from and the date.
It's the Tribune Democrat, and it's November 22nd of 2013.
Okay, thank you. And that tests the patient's near vision to see if they can see properly. Can you tell me if you wear any glasses or contacts?
I wear contacts and glasses.
Okay.
Currently I wear contacts in.
Okay. Could you please read for me the fourth line up from the bottom?
DEFPOTEC.
Now I'm going to grab the ophthalmoscope and examine the patient's eyes. Can you look here straight at my nose, please? Now I'm going to test your oculomotor, your trochlear, and your abducens nerves. First I'm going to test the pupillary reflex, which will tell you if the patient's pupils react to light. Go ahead and look straight at my nose here. Next, in the assessment of the trigeminal nerve, I'm going to ask the patient to clench her teeth tightly closed, and I'm going to palpate the temporal and the masseter muscles. Clench your teeth for me. Okay, and now just open and close your mouth for me. Okay, and close it. Good. The next thing we're going to do is we're going to test your facial nerve, which is cranial nerve 7. And any deficits noted here is going to be upper or lower neuron deficits. Can you smile? Now show me your teeth. Okay, close your eyes. And now I'm going to try to hold your eyes closed. I want you to open them for me. Okay. Now puff out your cheeks. And now I'm going to try to push them in. Don't let me push the air out. I want you to raise your eyebrows. The next thing we're going to do is your sense of taste. What you want to do is have the patient take a sip of water to cleanse their palate. Close your eyes and open your mouth, please. Stick your tongue out. And what does that taste like?
Sugar.
Okay. Close your eyes again. Next, I want you to taste this.
Salt.
Okay. And last one here. Go ahead and open your mouth.
Vinegar.
Okay. Next nerve we're going to test here is cranial nerve 8, which is the vestibular cochlear. There's 3 tests that you can perform here: the Weber test, the Ryan test, and the Romberg test. The Weber test is where you get your tuning fork. You would strike it in your hand and place it on the top of the patient's head in the middle, making sure that they note it equally in both ears. The Ryan's test is where you strike it, the tuning fork, you place it beside the ear, and the patient tells you when they do not hear the vibration. You want to repeat this in both ears. The next part of the Ryan test is the mastoid bone, where you strike it and you place it on the mastoid bone behind the ear, and the patient tells you that if they feel the vibration, if they don't, and when it stops. The last one is the Romberg test, and that's when the patient stands with their feet together. You have them open their eyes and stand there noting if they sway back and forth. Then you have them close their eyes and notice if they sway back and forth. And first I'm going to perform the Weber test. You hear it? Yes. Okay.
Alright. It's done.
Okay.
I feel that in here. And it's done.
Last one is the Romberg test. Can I have you stand up, please? And can you just stand with your feet together and your hands at your side? Okay, and this one you do with the eyes open first. Notice any swaying in the patient's movement, which he has none. And go ahead and close your eyes for me. Now this is noting swaying as well, and she has a little bit of a sway towards the back, but she corrects her balance. Next we're going to test the glossopharyngeal and the vagus nerve. Can you open your mouth and say "ah" please? Okay, and I'm just going to gently touch the back of your throat. Okay, and that elicits a gag reflex, so that is I'm going to test the accessory nerve, which is cranial nerve 11. Can you turn your head side to side for me? Okay, and now I want you to turn your head towards my hand. Okay, And I'll turn your head towards my hand again. Now here you're going to note strength. Can you take your right ear and place it on your right shoulder without shrugging your shoulders? Okay, and now do the same with the other side. Okay. Next, I want you to shrug your shoulders and try to push my hands out. Okay, and there you're testing strength is to test the hypoglossal nerve, which is cranial nerve 12. Can you stick your tongue out for me? Okay, and now put your tongue back in. Now stick your tongue to your left side. Now stick your tongue towards your right side. Okay, now I want you to keep your mouth closed and push your tongue on your cheek. Okay, I'm going to push against it. Okay, same with the other side. And here you're also noting strength as well. Next, that concludes the cranial nerves. So next we're going to test motor function, gait and balance. So can I have you stand, please? And what I want you to do is just walk about 5 feet here. Stand right here. Take your heel to toe. Take about 5 steps. And here you're noting the patient's gait, if there's any gait disturbances. Finger to nose test. I'm going to ask you to keep your eyes open and place one finger on your nose and have the other arm extended. And repeat this step about 3 times. Okay, and what else I want you to do is this time I want you to have your eyes closed and perform the same task. Okay, test that I'm going to perform is with the patient palms facing down and palms facing up. And you're testing for rapid movement of the palms. So have your palms facing down, okay, and then just alternate them rapidly. Okay, and you're going to notice any deficits there of one finger test. You're going to place your thumb and touch each one of your fingers. Okay, on the same other hand as well. Okay, you're going to note any deficit there. The next is the heel to shin test, and you could just extend your leg. And what I want you to do is I want you to take the heel of your one foot and slide it down the heel of the shin of your other foot. Okay, and do that with the same of the other one. The next test we're going to perform is just general sensory function test. One of the first tests that you're going to perform, if the patient had any decreased sensation to any of the testing, you're going to perform a hot and cold temperature test. You're going to get hot and cold water, place the patient's hand in the cold water, and see if they feel that, and then also place the patient in the hands in the warm water and see if they feel that. Can I just have you place your hand in this water here and tell me what that feels like?
That's cold.
Okay, and now go ahead and place your hand in this one here and tell me what that feels like.
That's hot.
Okay. You're going to strike the tuning fork and put it on bony prominences and see if they feel the vibration. Okay, can I just have you put your arm like this, please? One of the bony prominences is the elbow, so we're going to test that first. Do you feel that? Ceruginosis. Like I said, it's the ability to perceive objects without actually seeing what they are. Could you close your eyes for me? Okay, and hold both of your hands out, please. I'm going to place an object in both hands. One to begin with, I want you to tell me what it is. The second one, I want you to tell me what it is and if they feel the same. You can close your hand around it. And what does that feel like and what is it?
It's like a corner.
Okay, and this hand?
It's like my leg. It's like a dime.
Okay, and go ahead and close your hands together for me. And now, do they feel the same? Do they feel different?
They're different.
Okay, go ahead and open your hands up. So the test that I'm going to perform is the test for graphothesis, which is the ability to perceive writing. So I'm going to write different numbers in your right and left hand. I want you to tell me what it is. But first I'm going to have you close your eyes and place your palm out. Now whenever I write the number, just go ahead and tell me what it is.
3.
Okay.
10.
Okay. These senses typically develop within the first few years of life. Sense of motion, the sense of position. So what I want you to do is I want you to stick your foot out. What you're going to do is you're going to grab the patient's big toe and you're going to point it up, down, and side to side, which is testing the patient's sense of position of their body or a body part. Okay, go ahead and close your eyes. Now where am I pushing this?
Up.
Okay, and
Down.
now
Left.
and
Right.
okay. Next thing I'm going to test is reflexes. You're going to test the biceps, the triceps, the brachioradialis, the patellar, and the Achilles tendon, and you're also going to test plantar flexion and the abdominal reflex. Next, we're going to test the biceps reflex. You're going to place your thumb on the biceps muscle here, and you're going to strike it with the pointy part of the hammer. What I'm going to perform is the triceps. And I'm going to have you place your arm like this, okay? And you're going to support the patient's arm. You're going to strike the tendon, which is right above the osculum process, and it should elicit a response. The next is the brachioradialis. They're going to have their elbow flexed slightly, and you're going to have their hand resting on their thigh. You're going to strike about 2 to 3 inches above the wrist with the flat surface of the hammer. Okay. The next is the patellar reflex, which is the reflex that mostly everybody tests when you go to the doctors. The patient's leg is going to dangle, and you're going to hit right below the kneecap, and that right where the tendon is there, and it should elicit a response as well. Go ahead and dangle your feet. Okay, and same with the other one. Okay. The next reflex that I'm going to assess is the Achilles tendon. And this is the reflex that is behind the ankle. You're going to have the patient flex their leg at their knee, and they want to dorsiflex their foot, and you want to place your hand on the bottom of their foot. Okay, go ahead and place your hand in my foot here. Okay, and what the patient should do, their foot should jump. So you're going to strike the back of their heel right where their Achilles tendon is. Okay? The next thing you're going to do is assess the plantar reflex. What you're going to have the patient do is bring their knee, their heel up towards on their other knee, like they're going to cross their legs. You're going to test the bottom of their foot here. This is also going to test the Babinski sign. Now, a positive Babinski sign, the toes will fan out. This is normal in children from newborn up to age of 2. After that, it is not normal, and it represents a neurological deficit, mostly an upper motor neuron disease. Okay, and have their feet curl in. The last reflex we're going to assess today is the abdominal reflex, bottom of the reflex hammer. And you're going to test all 4 quadrants, usually starting in the right upper quadrant and moving in a lateral position towards the umbilicus. This should elicit a response of the umbilicus moving towards the applicator. So you would do it in this quadrant here and go down, and you'd note movement of the belly button, all 4 quadrants. This concludes the neurological assessment. Some general teaching tips that you would want to inform the patient of. Because the patient did state that she wears contacts in classes, you're going to inform them of proper contact lens care, making sure that you change them regularly like you're supposed to. Make sure you use a proper contact solution. Take them out every day. Make sure that there's no gunk or anything. Any irritation in your eyes, you do not want to wear your contact lens. You want to wear your glasses. If it persists, you want to see your eye care specialist. The only other general treatment If you have any neurological deficits noted during the neurological assessment, you want to seek further evaluation with your primary physician or with a neurologist or another type of specialist.